Hello guys, this is Nurse Christy. Today we'll be talking about a particular topic that will be beneficial for every group in the society. Now, today's topic will be dealing on resource incompatibility, which is one of the topics that majority of the people in the society has neglected, or it has little, should I say, much ignorance about it, because they only know about blood groups, genotype, but they didn't pay much attention to what we call resource factor, which has led to my topic for today. Now, let's dive into it. So, any immune related diseases can be very complex, broad, and even complicated when it comes to teaching or lecturing on it. But I'll try as much as I can to explain better by introducing it step by step. So today I'll be talking about what resource factor is, resource incompatibility, how it affects childbirth and pregnancies, and ways at which you can prevent and manage them. Now let's move into what resource factor is. Resource factor is a protein that we see on the surface of our red blood cell, like it comes around with our red blood cells. So 85% of the population already has this in their surface, and those individuals are called Rhesus positive. Now, those individuals are called Rhesus positive, and this Rhesus factor notes along with individuals who have A positive, B positive, and O positive. Then on the other hand, 15% of the population doesn't have this on the surface of their red blood cell. These individuals, we call them Rhesus negative. The other one was Rhesus positive, this one is Rhesus negative, and it always knows around with, along with people with A negative, B negative, and O positive. Now this is all about Rhesus factor. Now, Rhesus incompatibility is just like the Rhesus factor disease itself, or you call it hemolytic disease of newborn, because it only affects the newborn. In this case, the mother is safe, like there's nothing wrong with the mother. Now, this situation occurs when a Rhesus negative mother gives birth to a Rhesus positive fetus, like a baby in utero, like still in the womb. That is when such incompatibility occurs. Now, this condition happens when there is an exchange of blood between the mother and the fetus, and often occurs during childbirth. That is for the first issues, right? For the first issues. Now, when this happens, the mother's body build what we call antibodies. Now, these antibodies is what will attack the baby's red blood cell. That is if it is positive. Remember, I said when a Rhesus mother who is negative produces a Rhesus positive baby, right? So when there is a mix-up somewhere, like a mix of blood during childbirth through the placenta or the umbilical cord, when there's a mix, the body will start building up what we call antibodies that will attack subsequent births. Now, how does this thing happen? It happens because that antibodies that the mother has built on the body, when the mother is pregnant, the antibodies that's been built up by the mother, we identify that baby's red blood cell as a foreign body. You know, foreign body is something that the body doesn't know. Like it's just like you're trying to come into a house that you don't know anybody, you don't live there, you just came in. Now, normally it's supposed to be a good thing, you know, but because of that antibodies now recognize such red blood cell, Rhesus positive fetus red blood cell, as a foreign body, and now attacks it. That is the only way the immune system responds to such identification. It attacks it. Once it attacks it, it will lead to what we call destruction of the red blood cell. And once there is destruction of the red blood cell, it will lead to reduced blood production, that is causing anemia. Hence the reason why the another name for resource incompatibility is hemolytic disease of the newborn. There is occurrence of what? Anemia. Now let's talk about the compatibility of resource factors. But before I dive into it, I want to clear this notion of people saying that a child gets its rhesus factor from both parents, like it's half from one parent and half from the other parents. No, it is wrong. Rhesus factor comes from only one parent. One parent. It's either it comes from the mother or it comes from the father, and not half from here, half from here. Even now, let's move down to the compatible rhesus factors. If a woman is rhesus negative and gets married to a rhesus positive husband, they give birth to a rhesus negative child, the baby is safe because the mother is rhesus negative and the child is rhesus negative. So everything is what okay, no problem, go ahead and do the necessary things you want to do without even consulting a doctor regarding your rhesus factor. Now, if the mother is rhesus positive and the father is let me still go back to if the mother is rhesus negative again and the father is rhesus positive, and then just like I said before, the child can get it from the mother or from the father, and then the child gets it from the father and become rhesus positive in bed on utero. That means it is wrong. You have to do the necessary thing to prevent rhesus incompatibility, which I will definitely tell you later on this video. Then, if the mother is rhesus positive and the father is rhesus negative, and the child is rhesus negative, I know you guys will pay attention to this one because two of them are opposite. The mother is positive and the child is negative. So lo and behold, it is correct. Nothing is happening to that child as long as the mother is rhesus positive. Nothing is happening to the child and pregnancy. You guys are good to go. But problem occurs only if, take note, only if the mother is rhesus negative and the child is rhesus positive. Don't misinterpret this. Rhesus positive, rhesus negative, tick good. Rhesus negative mother, rhesus positive baby, tick bad. That is the only place you can have issue with rhesus factor. I hope you guys are understanding what I'm saying. So now the thing is, how does this rhesus incompatibility affect the baby? No, let me put it this way. How does rhesus factor affect the baby and the pregnancy, like childbirth and pregnancy? Remember I told you guys that it only affects pregnancy if the mother is rhesus negative and the child is rhesus positive, like what I said before, right? Now, how this thing happens is when there is a mix-up of blood, just like I explained the rhesus incompatibility. When there is a mix of blood from the placenta or the childbirth, and this thing tends to happen during the first pregnancy. In rhesus factor diseases, the first issues are not affected at all. They are not affected at all. They are safe. The people that experiences this is the subsequent birth, like the second, third, and fourth. But if care and management are being done during the first issue, like treatment is being taken during the first issue, yes, there will be reduced tendency of baby subsequent birth having that issue. But in a situation whereby it is left untreated, there will be a problem. Now, I know you guys will be asking, why don't it affect the firstborn? The reason is because during pregnancy for that firstborn, there is no escape of blood. There is no way that the blood can just escape to the mother's system aside during delivery, and that is when you always come about. There's a little, like a small, like a little amount of escape of blood that will now move to the mother's system and mix it. This is when the body will start building those antibodies if it is left untreated. Like if it is left on the mother's body untreated without doing anything regarding it, then if nothing is done, the mother will start building those antibodies waiting for the second one to come. And then when the second birth comes, it will now re-stimulate the mother to start building antibodies because already blood has already mixed together with the mother. Now is the placenta. Remember, placenta is another way at which baby can eat, blood can transmit from one place to another to ensure that the child is okay. That is their only means of communication, through the placenta. So since now the blood is in the mother's system, now that is in the mother's system, it can only get to the child through that placenta. That is if the baby is rhesus positive, because the body now will not attack the red blood cell of such baby, causing destruction of the red blood cell. Remember, the antibodies only attack rhesus positive babies and not rhesus negative babies. If eventually mothers, after giving birth to a rhesus positive child for the first issue, and then the second birth, the baby is now rhesus negative, it will not have anything to do with the baby unless the baby is rhesus positive. So if the baby is rhesus positive, that antibody will attack that baby, causing destruction of the red blood cell, which will lead the baby to what? Anemia, even to death safe, because most of them do come out as premature baby, stillbirth, and then underweight babies, because one, there's destruction of red blood cell, they are suffering from anemia, you understand? So all these things are cases whereby things that can affect the babies, the subsequent babies, if care is not being taken. Now there is another way at which firstborn can still be affected though. And these are cases whereby mothers had had abortion, maybe like second trimester abortion, type of abortion, or miscarriages that happened, you understand? So in that cases, blood has mixed together. So these are the only cases whereby a firstborn can still be affected. Now let's move into the prevention and management of rhesus incompatibility in situations whereby we found out late regarding it, or we knew initially that our rhesus factor is different from that of our husband, even though the rhesus factor of the husband self has nothing to do with it. But it is important for you to know, so that with that you can just go and make inquiries and get the necessary treatment you are supposed to get regarding it. But before I dive into this prevention and management, I have to tell you guys a story. This one happened in my hospital. Okay, there was this woman in my hospital. The 6-month-old baby was killed because of rhesus incompatibility, and this thing started because of the fact that she knew nothing regarding, she had little knowledge about it. So in the first pregnancy, the body had the chance to build up those antibodies because they didn't know. Remember I told you initially that if they know about it, they will give the necessary treatment, which I'll still tell you. So they didn't know about it, so the body had a chance to build up all these antibodies, waiting for the second one to come out. So immediately she entered the second pregnancy, and then the doctors were now aware about it. The second pregnancy came, everybody were taking care, providing management, monitoring her week by week. Even a graph was plotted to ensure that everything is going well, but all to no avail. Everything was just moving haphazardly. So within 6 months, the immune response started, just spiked. Let me just use the word spike. Just spiked strongly, and then caused the child to become in distress. And despite their treatment, the intense treatment that was given to the baby died due to the immune response caused by the mother's build up antibodies. So it was incredibly sad. So we could not do anything regarding it, because the lady got to find out late. That is just it. She got to find out late regarding it, hence the loss of the baby. Now in the management and prevention of this, now let me start with the prevention. And prevention is for you to ensure that prior to marriage and prior to pregnancy, you ensure that your rhesus factors is being checked. Yeah, you ensure that it is being checked with the first antenatal contact is between 6 to 10 weeks, right? So within that period of time, you can still check it. And once you check it, the doctors who are there, the midwife, the obstetric, will tell you and brief you about what rhesus incompatibility is, and with them, due care will be given to you. That is number one, prevention. And then number two is having the mind to, let me not say mind, having the urge to ensure that you listen to health talks. Most times it helps. It helps for you to be aware about this. I know most times everybody's busy, might not even have time to go through the books and every other thing, but internet has made it easier for us to have access to so many informations. You understand? Because I noticed that what most people know is blood group, just like I said before, blood group, genotype, mental fertility tests, mental capacities, compatibility, I meant to say. So they don't pay more attention to resource factors. So please, with these two, we can prevent this. Then in the management, once the doctors are aware that you might be experiencing resource incompatibility, at the 28 weeks, they will give you what we call ROGAM. It is an ROH-D, like an antigen D. That will help to prevent resource incompatibility. So if they give you at your 28 weeks of pregnancy, the next second dose that will be given to you will be 72 hours after delivery. You see, this 72 hours after delivery is always important to ensure you do that, because the body can still build up another antibody even though you have given the first program. You understand? Remember, it's still after birth when individuals who don't know anything about resource incompatibility tend to make the body build up these antibodies that destroy subsequent birth during the first pregnancy. So it is important to ensure that you let your doctor know about all this. Now, in a situation whereby it's late, like if you're in your second birth and they find out late, the only thing they can do is they will still give you at your 28th week, but they still have to start monitoring. There should be monitoring upon monitoring upon monitoring, because already the baby is already formed, is there. It is there already. The body has already recognized it. It's not for the body, it's not for you to receive more monitoring care. The necessary thing they're supposed to do to ensure that the baby is safe. So please and please and please take this message that I've provided here very important. It is really, really important. I know how hard it can be when after carrying a child for a longer period of time, and then the child dies in the middle, or maybe when you give birth to the child starts suffering some short-term problems like that of the hemolytic disease of the newborn that comes as anemia. Now the baby will start receiving blood transfusion because he or she, or let me say the baby, is suffering from anemia. So nobody would want such a thing. Some babies get lucky and survive, some don't get lucky to survive. Another thing I want to talk about is for those that are still single and they are not yet married and they don't know their resource factors, but they got pregnant and there was some form of miscarriage or abortion. So in such situation, if it happens and the individual or the lady didn't take this anti-D, like the ROGAM D that I mentioned, that means subsequent birth are at risk. If the person marries and gives birth and is pregnant for the first time and is a Rhesus positive baby, the child is at risk. It is very, very at risk. That is why it is important for you to have knowledge about it. If you tend to abort a child during your younger youth without you knowing about this, please know about this. Go to your doctor and explain to him. He will definitely give you that ROGAM D. If you do abortion or had a miscarriage, and after 72 hours of having those mix of blood, like those abortion and miscarriage, and you do not take ROGAM D, your subsequent babies are at risk. I just wanted to let you guys know about this for those that are not married, because I've been explaining regarding those that are married. For those that are not married, the young ones, the ones that are yet to. So I want you guys to have this in mind, because there's some situation whereby you've done all these things when you were young, and then you want to get pregnant, you start having miscarriages. So most of them are being caused by these things, resource incompatibility that happened to you when you were young. Most of them are being caused by it. So the young girls, you all should be very careful. Please, you guys should be very, very careful. very, very, very careful. Now, this comes to the end of my topic. I hope you guys enjoyed it. I know I tried as much as I can to break it down in the way that you understand it. Please and please, if there's a way, if you have any question, drop it on my comment section. I will definitely come and answer it. I promise. I won't leave any question unanswered. I am here to serve you guys as a registered nurse. So I will definitely do my duty by replying your messages and giving you the answer that you require. So stay tuned for more topics to come. Please follow, like, share. Here is my YouTube handle. Please follow, subscribe, and comment. Thank you, and have a very nice day or morning, depending on where you are watching from.